You're watching TVC Breakfast. In the last 83 days, Nigeria has been fighting a common enemy, the coronavirus pandemic. From just one case recorded on the 27th of February, Nigeria has now recorded more than 6,000 cases. More than 190 people have also died from COVID-19 complications. But has the strategy for fighting coronavirus yielding a positive result? Is it yielding any positive result? That's the question. And Nigerians are certainly watching and seeing what the government is saying and what health experts are saying and all the advice given to them. Joining me now is Dr. Phillip Idaewor. He is the chairman, People's Health Foundation Board, and also a cellular pathologist with the UK National Health Service. And he's joining me from the UK. Dr. Idaewor, good morning. It's good to have you join us on TVC Breakfast this morning. Now, when it comes to the fight against COVID-19, certainly all countries of the world are at it at this moment. But if we look at the strategies for fighting COVID-19 across the countries are not the same. I know you have been involved in the fight against COVID-19 in the UK, being a health worker one way or the other, and you've been monitoring what's going on in parts of Africa as well. What more can anyone do at this time with the numbers increasing by the day?
Well, thank you very much for having me on your program. Firstly, I think that with regard to the Nigerian government and the situation ongoing at home, I think that the government has done brilliantly. Let's be honest about this. They acted and locked down the country as should have happened. Now, I think that the challenge facing Nigeria, as in most developing countries around the world, is the acceptance and uptake by most members of the public. And also the fact that where people have accepted the reality that this is a virus and that it is effective and that it has the potential to kill, there is the fear of what might happen. So reactions and responses by individuals vary quite a lot. But I think that with regard to Nigeria and what one sees watching from outside, is that the Nigerian people themselves need to step up and own this war against the coronavirus. It is real, and it is an infectious disease, like I call infectious diseases, unless we as individuals will take personal responsibilities. It doesn't matter how much money government throws at some of this stuff. If the individuals don't act right and appropriately, every effort by the authorities will always come to very little. So I think, yes, the government is doing a lot. Of course, there is room for them to do more and to improve in certain areas, especially with regard to the vexing issue of lack of data to monitor and to plan appropriately in Nigeria. But I think that the Nigerian people need to own the whole agenda of the war against the coronavirus SARS-2.
All right. WHO has warned that gloomy days ahead await especially sub-Saharan African countries. Bill and Melinda Gates Foundation said the same thing. In fact, they used the word horrible, that there will be horrible days ahead when it comes to what COVID-19 could look like in sub-Saharan Africa. Nigeria is among those classes of countries. Now, what can be done differently? Like you have said that the government is doing fantastically well, but what else can the government do to ensure that it doesn't get as horrible as it is being predicted?
I think the first thing I would say is that government should not panic, and there should be no knee-jerk response. There are known knowns. There are things that are known about the behavior of this virus. This virus is a coronavirus. It is not the first coronavirus that is being identified. In fact, it's the third of the coronavirus family that is affecting human beings. So we do know something about it. We've had the coronavirus 1, which started from China sometime in 2002. There has been the Middle Eastern respiratory virus, also a member of this coronavirus family, that came on around 2012 or so. And then this third one, which started 2019. So I think that the government should stay steady. The government should ensure that there is no panic. But above all, they should make sure that this is used as an opportunity to set in motion the process of documenting data-wise Nigerians. The issue of appropriate and accurate data collection should not be a political matter. It is an essential issue for all countries of the world. And if you look at countries that have done very well in terms of how they have handled and responded to the coronavirus COVID-19, you will find that these are countries that have well-detailed data management. Talk about a country like Sweden, for instance. Sweden didn't go into lockdown like most countries have done. But one thing about that country is that their data is top-notch. Every person is documented. Your card tells the government exactly where you are. And the same thing with China. So we know that data is important, in terms of how you help the citizens. It is about helping the citizens to understand and the severity or the acuteness of this situation, and also where you have errant members of community, they can easily be tracked down and handled. So, if, for instance, we were to do testing, tracing, and of contacts, and then isolation, for instance, it's going to be more difficult in a place like Nigeria, and that is what should happen in a resource-poor environment. The idea should be test, trace, and isolate. That is important because we know that, firstly, in Nigeria, the healthcare system is very weak. Because we just don't have the resources for that. No government in the world can provide healthcare for everyone from their pocket. It always has to be a synergy between government and citizens. So again, I give example of Europe. You find that in virtually all European countries, there is some consistent contributions of citizens to a fund that is set aside for healthcare. So, for instance, in the UK, we pay our national insurance, and it is from national insurance that the NHS is funded. And therefore, at the point of need, at the point of care, we are not asked to pay for services. These are the kind of things that we should begin to look at with regard to Nigeria, and we should be a leader, in terms of healthcare, because around the world, wherever you go to, you find Nigerian medical healthcare experts who understand and know what should be done. We shouldn't be in a situation where the citizens expect the government alone to provide healthcare services for everyone, because it doesn't work that way. So I would say that what the government should now be focusing on should be to up the game with regard to testing. At the moment, it is very poor. Testing in Nigeria is very, very poor. Testing, contact tracing, and isolation. These three will help to mitigate the predictions that have been given by WHO and by Bill and Melinda Gates Foundation. In my opinion, I am not that gloomy. I don't think that it's necessarily the case that things are just going to be horrible in the third world countries. Why do I say this? It is the fact that these populations are young. Majority of Nigerians are young. Up to 70% of the population is young, and we do know that in terms of how how we respond to COVID-19, the case is that young people tend to the outcome for young people tends to be better compared to the elderly population. All right. And, yeah.
Okay, we have to leave it here now. Thank you very much, Dr. Phillip Idaewor. Thank you so much for talking to us from the UK. You're watching TVC Breakfast. In the last 83 days, Nigeria has been fighting a common enemy, the coronavirus pandemic, like any other country in the world. From just one case recorded on the 27th of February, Nigeria has now recorded more than 6,000 cases. More than 190 people have also died from COVID-19 complications. But has the strategy for fighting coronavirus yielded positive results? That's a big question in the minds of Nigerians, especially when they look at the numbers increasing by the day. Joining me now is Dr. Phillip Idaewor. He is the chairman, People's Health Foundation Board, and also a cellular pathologist with the UK National Health Service. He is joining me from the United Kingdom. Dr. Idaewor, thank you so much for coming on the program. Now, when we look at way forward for COVID-19, the projections seem to be really scary, especially for sub-Saharan African countries, when WHO, Bill and Melinda Gates Foundation are saying that it's going to be terrible for African countries. But within African countries, we're hearing of breakthroughs. In fact, the Madagascar story is there. Whether it is still going to be subject to all of those is another issue altogether. But from Madagascar to South Africa to Nigeria to Ghana, there are lots of people within indigent of those countries coming up with news that they have breakthroughs, that they have possible solution to COVID-19. What do you say?
Mike, I think that we need to be very careful.
Okay.
The human body is a very finely tuned machine. In other words, whatever you take into it, the body has a way of dealing and handling it. A lot of stories are going on about herbal therapies that are being discovered in these various African countries you refer to. The Madagascar one is a mixture of herbal therapies. I think that it is a good thing that we are looking inward as indigenous attempts to deal with our disease problems. But I think that with particular reference to Nigeria, I say this all the time, I believe that Nigeria should be a leader in when it comes to areas like medicine, for instance, because of not just our size, but the human resource that we have. I think that there is a need to use the opportunity that we are confronted with at this time to ensure that research into our indigenous healthcare practices becomes something that is very, very important. Herbal medicines in Nigeria, you have a lot of researchers across the various universities who are doing a lot of work. I mean, I in the past joined up with colleagues to work on some herbs in the country. I think that there is a need for in-depth research, bringing together experts. This is where we should be looking at people in Nigeria who have the wherewithal. We keep referring to Bill and Melinda Gates. Look, I believe that we have Nigerians who are resourced enough to set up foundations as well, focused on medical research. We have so many of these funding research in the so-called developed countries, in the US, in Europe, and all of these places. I think that this is one thing that we should be looking at. Our wealthy people should begin to look at setting up trusts or foundations focused on medical research, and these foundations should give grants. I don't believe that government alone can take care of these issues of this sort. Yes, government should also put in place clearly defined criteria for funding medical research in Nigeria. It is only through research into our indigenous healthcare practices, into our herbal systems, that we're able to isolate the active ingredients in all of these agents that are being bandied about. Two, we were able to take the processes through clinical trials, having tested them on animals. And then three, ensuring that they are not just safe, but the dosages are clearly identifiable and are well stated for each of the drugs that eventually finds its way into clinical work. This will save the country a huge amount of foreign reserves, foreign income, because then for some of these drugs, we will no longer need to import them. I don't think we should throw away what we have. I think that we should instead invest in research on them.
Okay, to make them better. Now,
yes.
Dr. Idaewor, a lot of people, world leaders, health experts have said that the world may never remain the same again after COVID-19, after shutting down the world for a period of time in different countries and all of that. What's the ultimate lesson that humanity has to learn from COVID-19?
Well, I think that, in my opinion, is to know that, look, we sometimes we think that as human beings we know everything. I think COVID-19 is showing us that that is not the case. Whether we talk about science or we talk about social sciences, the issue of social distances or physical distance is just one example, because here we are finding that we are, for the first time, people are beginning to recognize that medicine is not just science. Medicine is science with a mixture of art and also environment and social sciences. It's a whole, that is why it's so complex, because we tend to look at the doctor as somebody who just looks at you, examines you, and gives you a prescription. That is not the whole story of medicine. I think that COVID-19 is showing to us for the first time that for us to maintain our complete health, we will have to restructure the way we do things.
All right.
There is no doubt that we are not going to return to normality as we knew it, whether in travel, whether in our workplaces, whether in our in the parks. And these are never going to be exactly the same again. There is no doubt about that. But I think there are big lessons, and I think there are advantages to what will eventually happen, depending on how we interact with these.
Okay. We have to leave it here now. Dr. Phillip Idaewor, thank you so much for talking to us on TVC Breakfast.